Talk Live, a health show brought to you by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. The show is also sponsored by Zyga Healthcare Group, a leader in providing senior living, home health care, and hospice-related services throughout the entire DFW Metroplex. My name is Dr. Samir Nangia, and I'm excited to be back here in Doc Talk Live studios. It's been a long time, and we look forward to having another great show for you. Make sure you go to our website. It's doctalklive.com, and that will be getting a facelift very soon, and you will be seeing new stuff on there. So please go to the website, and if you have any question, make sure to fill it out. Again, that's doctalklive.com. And while you're at it, please head on over to our new YouTube channel, Doc Talk Live. Make sure you like it, comment, and even subscribe to the YouTube channel. And there you'll also be able to see all the videos from before. That's pretty exciting for us as we venture onto YouTube as well as Facebook. Also, if you're a healthcare professional and would like to be on the show, please send a... Ladies and gentlemen, we have a great show for you all. Today's will be very exciting for our female listeners, especially those that are mothers or soon to be mothers. As we know, being a mother is one of the hardest jobs out there, and a lot of times that can take a huge toll on a woman's body despite the exhausting efforts of exercise and dieting, and sometimes it's still not enough to get you back to your pre-baby look. That's why today we have a discussion here on what's called Mommy Makeover, and we're privileged to have Dr. Solomon in studios with us. And to be part of the conversation, please call us at 972-235-5555. Again, the number is 972-235-5555, and we'll be taking your questions live throughout the show. Dr. Solomon, welcome to the Doc Talk Live family. Thank you for volunteering your time to be part of the show. Why don't we start out by you telling us a little bit about yourself to the listeners?
Thank you, Samir, for having me on the show. So I'm a plastic surgeon, board certified in plastic and facial plastic surgery. I actually happen to be the only person in the Metroplex who has both these certifications. Briefly about myself, I did my medical school and surgical training in India. I graduated as a gold medalist in my surgical program. After that, I spent a brief period of time in England where I did my fellowship from the Royal College of Surgeons there. And eventually I came to the USA and essentially redid my entire surgical training, where I did my general surgery at Thomas Jefferson University in Philadelphia, which is considered among the top 20 medical hospitals in the country. And after that, I went to the Mayo Clinic to do my plastic surgery training. After working in Minnesota for a while, I've relocated to Dallas, and I'm proud to call Dallas home.
Well, thank you so much for being on the show today. And I just wanted to throw out some statistics before we start our show. According to the annual plastic surgery procedural statistics, there were 15.9 million surgical and minimally invasive cosmetic procedures performed in the United States in 2015, a 2% increase over 2014. Since 2000, overall procedures have risen 115%, but the types of procedures patients are choosing are changing. Since 2000, the SPS statistics show considerable growth in breast lifts up to 89%, buttock lifts and up to 252%, and lower body lifts up 3,973%. So a lot of new stuff going on. And the SPS statistics show a rise in mommy makeovers in the past decade. The number increasing by quite significant rates. So Dr. Solomon, can you explain to us what exactly the term mommy makeover means?
Okay. Mommy makeover is really a common term for a couple of medical procedures in combination. Essentially, the idea is to restore a woman after childbirth and pregnancy back to what she looked like before. So the term mommy makeover includes a combination of abdominoplasty, commonly called as a tummy tuck, and some form of a breast operation, which could either be a breast reduction, a lift, in augmentation with an implant, or one of the different variations on these procedures.
Dr. Solomon, when is the best time to have a mommy makeover, and what are the different options for a mommy makeover?
Okay, so the best time would be, my recommendation is to tell anybody, finish planning your family. There are certain parts of the operation that can change afterwards. In other words, the results can change if there's further pregnancy, childbirth, lactation after the procedure, because as part of the operation, which we'll cover in a little detail later, the abdominal muscles are tightened. So obviously you don't want to re-stretch them by having a pregnancy. Similarly, after any kind of a breast procedure, if there's lactation and engorgement of the breast, that potentially can change the results and the outcome.
For those who are just joining in, you're listening to Doc Talk Live. We're live in studios with plastic surgeon Dr. Solomon. Then we're discussing Mommy Makeover. The number to the studio is 972-235-5555. Again, 972-235-5555. We'll take your questions live on air. Dr. Solomon, what can you expect at an initial consultation? I know many mommies may be nervous about getting a mommy makeover, so what do you guys talk about? And is the mommy makeover done all at one time? And most importantly, I know everyone is thinking, how much does this cost?
Okay, so at initial consultation, I know from a patient's perspective, it's kind of it's a delicate topic to talk about. I mean, I do this every day, and I'm very comfortable in dealing with pretty much all the questions and concerns that may come about. I typically spend about an hour talking to prospective patients. I educate them first on what the procedure is. I examine them in detail, and this way I can kind of tell them in their particular circumstance what the best options would be. And I always have a female, staff, my patient coordinator, there with me, so that way the patients are, comfortable. There's another woman in the room, and we go from there. Cost-wise, it really varies based on the combination used. It could be an abdominoplasty, which is a tummy tuck with a breast reduction, for example, or a lift, or sometimes implants are involved. So obviously the costs vary based on the amount of operating room time and the implant involved.
Welcome to Doc Talk Live. You're on the air. Please go ahead with your question.
Yeah, I wanted to understand why plastic surgery would be considered. Is it considered a better option than actually trying to do a diet plan or exercise and try to get your body back to where it was?
Yes and no. Diet and exercise works if somebody is overweight after pregnancy, childbirth, and they want to kind of come back to their pre-pregnancy weight. But there are certain elements here that are fairly irreversible, and this really depends on everybody's body structure and genetics. There are some women who undergo changes in the breast, meaning the breast gets very droopy, there's a lot of loose skin, and no amount of diet or exercise can actually improve that. And the volume is lost too. Obviously volume and shape is lost, and this is not reversible. Similarly with the abdomen, sometimes what happens, the abdominal muscles kind of spread apart. There are two central abdominal muscles that spread apart called diastasis. And no amount of exercise can really tone these muscles back unless you're surgically put back in the midline. And also with excess skin in the abdomen, again, exercise cannot remove excess skin. Surgery is probably the only option.
Number to the studio is 972-235-5555. This is Doc Talk Live. We're waiting for your calls to be answered by our expert. Dr. Solomon, who would be a good candidate for abdominoplasty? What are the components of this procedure?
Okay, so there are three traditional components of the operation. The first component is all the excess skin starting from just below the breast to the pubic area is completely removed, and it's flank to flank, in the side aspect. The next component is the belly button, or the umbilicus, is completely refashioned. If you notice, most people who have excess skin have a very unshapely belly button that kind of gets buried inside. The third component is tightening the abdominal muscle. What happens after pregnancy is a stretch of the abdominal muscle, which gives a convex appearance to the abdomen, which normally, ideally, is concave.
So number to the studio is 972-2355-5555. Let's take a live call. You're on the air. Please go ahead with your call. So, Dr. Solomon, what results can one expect with the tummy tuck procedure? What is the minimum recovery time for mommy makeover, and how much time will have to take off from work?
Okay. Results-wise, what I tell my patients is you can expect a completely flat abdominal contour all the way from just below the bra line to the pubic area and from flank to flank in the sides. In other words, when you stand with the arms by your side, everything below the breast to the pubic area and between your arms will be completely flat, completely contoured, and all the excess skin will be gone. In terms of recovery time, I tell my patients that for the first 2 weeks it's going to be a little painful. For 6 weeks I tell them not to do anything very strenuous like jogging, bench press, and those kind of things. But normal activities, walking, climbing stairs, I encourage them even the day of the operation.
Great, let's take a live caller. Hi, you're on the air. What's your question for our expert?
Yes, sir. My question is, what are the risks of having this surgery?
Excellent,
Thank you.
excellent question.
Okay,
Oops.
there are two different areas from where complications happen. The first is related to the operation, and the second is related to anesthesia. From a practical standpoint, I do a lot of these. I really never ever see problems. But potential things that can happen would be infection, which if it happens, I remove a stitch or two, let the infected fluid out, and things subside. Bleeding can happen with any operation, which means we go back to the operating room, say the night of the operation, we see what's bleeding. It's not usually life-threatening bleeding, it's just kind of a nuisance which needs to be addressed. So infection, bleeding, the chance of both of these are less than 1%. Then obviously the scar, I do the operation the exact same way, but some people form a very fine scar, while others form a slightly wider scar. But the good thing is the scar is completely hidden under the underwear line. If you go to my website, solomonplasticsurgery.com, there are many photographs of before and after results, and you can view them. The second group of complications of anesthesia, again in 2017 with modern anesthetic, it's uncommon to have a problem.
Great, let's take another caller. Hi, you're live on the air. What's your question for our expert?
Hi, I'm not sure if somebody already asked, I just joined.
Sure.
I wanted to know about diastasis recti.
Say that again?
Diastasis recti, and is there any proper treatment for that? Because that's where the muscles are stretched out and can be put together.
Right. So diastasis is nothing but a medical term. See, there are two muscles in the midline that go all the way from your ribs upwards and attach to the pubic bone down. They're like a ribbon. It's what the bodybuilders would call a six-pack muscle. So these muscles separate, and there's a lot of space between the two of them after pregnancy. Not in everybody, but in some of them. So with diastasis repair, I bring the muscles back together and put them back in the midline. There's really nothing known other than surgery for that problem.
Thanks for those who are just joining in. You're listening to Doc Talk Live. We're talking about mommy makeovers. We're about to head into the break. You guys have asked some great questions, and call during the break. It's 972-235-5555, and we'll take your questions live off air. We'll be back in 5 minutes.